Okay, we're live, Chair.
Great, thank you. Good afternoon, everybody, councillors, officers, members of the public and guests. Welcome to this meeting of the Outbreak Control Engagement Working Group. This is a remote meeting, obviously, and it will be streamed live and recorded on our website. I'll now hand over to Joe, from the Democratic Services team to go through the roll call.
Thank you very much, Chair. I'll just start with a quick roll call. When I say your name, if you could confirm that you are in attendance, that you can see and hear everything and that you have all the papers, please. I'll start with Councillor Moore.
Present, correct, I have all the paperwork.
Thank you very much. Councillor Thomas.
Yes, I'm here and have the paperwork.
Thank you very much. Councillor Harrison.
Yes, everything's fine. Thanks, Joe.
Thank you very much. Denise McGuckin.
Yes, Joe, I can see everyone and I have all the papers. Thank you.
Thank you very much. Do we have Dr. Butler with us? No, I'm going to assume not. Karen Hawkins.
Yes, present. Thank you.
Thank you very much. Leslie Wharton.
Yes, present. Thank you.
Craig Lundred.
Yes, I'm here. I've got all the papers. Thanks.
Thank you. I've got apologies from Sally Robinson. Do we have Sharon Cooney with us? No. Do we have Jill Harrison with us? Okay. Is Tony Hanson with us?
Hey, I'm Joe. Afternoon.
Hello. Hi, Tony. Ed Turner, are you with us?
I am. Thank you, Joe. Yep. Yes,
thank you very much. I've got apologies from Councillor Akers-Belcher. Julian Penton.
Yeah, present with paperwork.
Thank you. Is Reverend Delves with us? No. Jacqueline I also understand I've got Graham Trory with us as well. Yeah, is that correct?
Yes, sorry, I was on mute. Yes, here, and I've got paperwork. Sorry.
Thank you very much. Is there anybody on the call that I haven't named?
Joe, yeah. I forgot to put Jill Harrison's apologies in. I do apologise.
No problem. Thank you very much. Right, I think that's everything from me. So back to you, Chair.
Great. Thank you, Joe. So we've got notes from the meeting held on the 11th of December are attached. Are there any questions or comments on those meeting notes? All right, are we happy with them as being a true record? I don't see anybody raising anything. Okay, we'll move on to the coronavirus in Hartlepool, a data update presentation from the Director of Public Health, Craig.
Thanks. I'll just see if I can share the screen. Hopefully it'll work this time. Can everyone see that?
Yeah. Yes.
That working? Yep. Excellent. Okay, I think probably most of you will be familiar with the sort of setup layout of this by now, and I'll just talk you through some of the current data that we have regarding the COVID-19 infections in Hartlepool. The first graph just goes to show the weekly cases from the 1st of October. And again, as I've pointed out, we did reach that peak in January, pointed out previously. What you can see from that is it's tailed off quite significantly since January, and towards the end of the graph is some of the most recent data up until the end of last week, which shows that we've come from around about the 780 mark in January down to per 100,000 for the weekly cases, down to around about just over 100. I think one of the interesting things to point out, though, at the moment about this data, we came down quite significantly, but one of the things that we're seeing at the moment is we're persistently stuck around the 100 to 130 mark and have been for several days at the moment. And I think it seems to suggest sustained transmission at the moment. It's persistently holding at that level despite all of the things we're doing, and I think it's going to be challenging to try and get below that. I think one of the slight concerning things we have is that we've seen other parts of the northeast have dropped quite significantly down below 100, but we haven't really got that far yet. I think probably the lowest we've got has been about 109 per 100,000. So I think there's certainly a lot of things we need to look at in terms of additional measures to put in place to see if we can bring that down even further. I think as we progress, there's obviously going to be things that will contribute to bringing the numbers down, but I think such as the vaccinations, and I think one of the concerns I had was that as we came out of lockdown, we might start to see the numbers rise again. So on the one hand, you know, there is some positives in that we haven't seen it start to rise quite significantly, but on the other hand, I think the challenge is that it's not falling as much as we would have hoped either. One positive is that the death rates have sort of flattened out. We certainly aren't seeing as many deaths from COVID as we have done in the past. I think we're very much down into the weekly single figures at the moment, so that's a positive, and I think that obviously again reflects the decrease in the numbers of cases. As you can see from the England and Hartlepool comparison, both on the chart we had before and this chart, we are still obviously higher than the average England figures as well, which is a bit of a concern. It's just showing the distribution of cases around Hartlepool in the first week in March. As you can see, it's fairly generally widespread, but one or two pockets there where we sort of focus some of our efforts. But again, you would expect to see higher rates in those areas because of the population and where they're at. Interestingly, we have seen a rise in testing over the last few weeks, and that's for a number of reasons. One of the reasons, obviously, is that schools have come back, and so we've seen an awful lot of testing coming through schools. And I think it's interesting, going back to what I was saying about the number of cases we're seeing coming through. One of my concerns was that we really wanted to get the case rate down as low as possible prior to schools reopening and going back, because we were anticipating seeing a spike in the number of cases. Interestingly, and I'm looking for every piece of wood in this room to touch, we haven't seen a huge spike in cases as schools have come back. What we were anticipating was that as schools were testing more and more pupils, we would start to see an increase in the number of cases. And as I pointed out in the first slide, that hasn't happened, and we're not seeing at the moment high numbers of cases coming through schools. So that's quite a positive at the moment. We are seeing lateral flow testing is being rolled out to businesses. We have our mass testing centre at Mill House, and we have lots more opportunities for people to be tested in the workplace or to order home testing kits, and the rollout of Community Collect, where the families and bubbles of children in school who are being tested are able to get home testing kits as well, has seen an increase in the number of tests. And again, it is interesting that those numbers have still maintained the same sort of level over the last couple of weeks or so. So it's quite an interesting phenomenon there. Moving on to the vaccination, just a few figures, and we'll talk about vaccinations a bit later on after this. The figures are showing they're quite strong across the town. One of the things we need to look at is, and we'll talk about that in the vaccination section, is around the inequalities and how we tackle those. But at the moment, there does seem to be quite a strong showing in terms of people having uptake of the vaccination. And if we look at the age groups there, we can see probably in general around about a third of the population, eligible population, have been vaccinated already. And again, the age groups reflect those that are called earlier. So we've seen the 80 plus, 75 to 79, 70 to 74 were among the first to be called. So there are more people in those groups that have been vaccinated or had their first vaccination rather already. And that is really positive and is a good news story. And I think certainly we're starting to see from the data that we're getting through that the effect of the lockdown and the vaccinations is certainly starting to have an effect in the older age groups, whereas we've seen, particularly I think in the 80 plus, the numbers of cases has reduced quite significantly as we've gone through the weeks. So that's elements of good news there as well within the overall presentation. So I think it's probably best to finish on that good news story about the vaccinations, and I shall try and unshare my screen just so we can get, is that unshared? Am I back?
Yes.
Yeah.
Yes, excellent. Any questions? All right, thanks.
Thanks, Craig. I did have something come through in the chat, but I've misplaced my glasses and the writing's too small for me to read, so I do apologise. Can somebody pick that up?
That was from me, Craig. It's Julie Simon. So yeah, it was just to ask about lifting that section, that particularly recorded bit, and popping it onto the now, or even us being able to kind of take that and post it out to our VCS newsletter as well.
Sorry, which bit was that?
Craig's presentation, his audio and visual. So that's that section of this meeting.
All right. Well, this whole meeting will be recording, and it'll be on our on our channel on YouTube. So yeah, I guess it would be quite easy to edit it and kind of take a clip, so to speak, of just that presentation that we can share a link. Or in fact, there's no need to do that either. We can just share the link for this meeting with a specific bookmark, which starts at the beginning of Craig's presentation, I believe.
That's good. Thank you.
I'm sure we'll be able to do that, Julie.
Brilliant. Thank you.
Cool. Are there any other questions for Craig? No? No. Brenda?
Thanks, Shane. It's a bit of a different hand thing, so I was getting a bit confused. Craig, I just wondered if there'd been any reaction to the news we're getting nationally about various countries suspending the AstraZeneca vaccination. That's the one that I had, and I just wondered if there was any kind of some people rather more worried about having that vaccination because of that news. Are you aware of anything, Craig?
I'm not aware of anything that hasn't been sort of reported back to me. I suspect it might be relatively early days, but I'm not sure if any of our CCG colleagues on the call may have been made aware of anything at the moment coming through the vaccination centres and practices.
Was that? Did you have any more, Brenda?
Well, no, I think Karen's got her hand up. Maybe she has some kind of information.
No, I was just asking because your hand was still up. That was all.
Oh, sorry. I'm terribly sorry. Well, I'm going to take a while to get it down, I think.
That's all right.
There you go.
I've got Stephen Thomas.
Thank you, Chair. Craig, are we seeing any changes in the numbers of people who are coming forward for vaccination as we start to get to slightly lower age groups? As I think certainly going forward, one of the concerns I think is going to be around younger people as they become eligible for the vaccination, opting not to take it. Could be linked into the sort of thing that Brenda's talked about. We've already heard about some concerns that younger women have about the safety of the vaccination, and again with the rate at which the infection rate is slowing in Hartlepool. I think that is a real concern going forward if we start to see a reduction in the uptake of vaccination, particularly as lockdown starts to ease in the coming months.
It is, yeah. And again, I think certainly referring back to my colleagues from the CCG who've been dealing with this, who I think we'll bring in a minute. But again, I think the next section on the agenda is we'll outline some of the options we've got for tackling that. We are certainly looking at an inequalities plan, which will involve not only looking at how we get to vaccinate those people who may be furthest away from us in terms of accessing services, but also in terms of issues around vaccine confidence and hesitancy as well. And those are key parts of the plan we're in the process of pulling together at the moment. And again, I think, yeah, you're right. As we progress down the age bands, I think that's going to become more and more important in terms of certainly understanding the community and what they believe about vaccines, and also as how we deliver that.
Thank you, Craig. Karen Hawkins.
Thank you, Chair.
So I'll respond to Brenda, Councillor Harrison, in relation to the AstraZeneca queries. We are about to issue a statement out on behalf of the NHS that will go out today, just in response to the concerns that are being raised around the Oxford AstraZeneca and the media reports. So the UK Medicines and Healthcare Product Regulatory Agency, so the MHRA, they are responsible for ensuring that the medicines and the medical devices work and are acceptably safe. And they have advised that evidence does not suggest that the Oxford AstraZeneca jab is linked to blood clots. And they are encouraging people to still go and get their COVID vaccine when asked to do so. And there's information that also we're awaiting from the World Health Organization to be able to put out and communicate out to partners and to the public to try and offer some reassurance in relation to the vaccination. So that will be in today and tomorrow, Councillor Harrison, that'll go out.
That's great. Thanks, Karen. Thank you. Because I just feel that it's rather worrying that, as Stephen has said, that people might start to query, whether to have it. I'm not querying that, by the way. I'm just thinking that there would be people who would be more worried than perhaps they already are. So thanks for that, and that sounds very promising.
And in relation to Councillor Thomas's query around vaccine hesitancy, we have shared some facts and frequently asked questions that have gone out to all the comms leads within the local authorities. We've also got it on our website in relation to some of those concerns that the general public are raising around all vaccinations, and particularly as we move down the age groups, to try and reassure again of the myth busting around the vaccinations themselves. So we can certainly ask, those are regularly updated. And what we've also asked is if you're getting some general queries and they're consistent, if you want to pass them through to us, and then what we can do is we can make sure that they're included in the frequently asked document as we go forward, so that that's updated. But we can certainly link back in with your comms team to make sure that you're cited on that as well.
Thank you, Karen. I've got Graham Tory.
Hello, hi. I think can you hear me? Yeah, okay.
Yeah.
Regarding the news about the blood clots, there was a number of inquiries yesterday to our practice, but not as many as we feared. And everybody was happy to accept that it was still a good thing to have the vaccine, and nobody declined it. And secondly, about the younger age groups, we've been inundated with people who are under 50 asking when is mine due. So I don't think there's going to be a huge turning it down of that age group. And even over 50 to 60, a lot have had theirs done in pharmacies, etc., or travel to Sunderland, etc., which surprised me when we've asked them already. So it still seems quite positive, actually. There will be a minority though, but hopefully a minority.
It's good. That's really good to hear. Thank you. Okay, so there's nobody else with a hand up. So thank you very much for that, Craig. It's you again, though. In fact, it's you all of today.
It's me all afternoon, isn't it? Yeah.
Yeah. For a vaccination update.
Yeah. Okay. Sorry, I should really get someone else to do this, shouldn't I? Otherwise, you'd just be bored with me. It just sort of neatly follows on from where our discussion, and as I just briefly mentioned there and alluded to, we are looking at what the local authority's responsibility working with our partners is to support the vaccination programme, and that's really predominantly looking at the inequalities agenda and engaging with our communities. So I think that's why we wanted to bring it to the engagement working group to start to lay out the plans we're thinking of, and we're working very closely with the CCG and the PCNs to develop this plan, as well as our voluntary sector partners as well. But I think obviously it's really important that we get all of the messages out as widely and into those communities as deep as possible, so we get as many people vaccinated as possible. And I think you've obviously all alluded to already some of the challenges we're likely to face or potentially likely to face as we go forward. So I think we thought, now is the time to really start thinking about the plan and how we will pull that together. So we've already started meeting with CCG colleagues and looking at partners across the whole of the Tees Valley to pull together a regional plan, and that's been drafted up because again, we've got lots of sort of similarities across the region, the sub-region rather. But then we obviously need to consider looking at how that really plays into Hartlepool and developing a plan to really tackle the issues we have here. So we've got some overall themes we need to look at, and again, we've alluded to some of them already, so that makes my job a little bit easier. So it's obviously looking at the inequalities around uptake, and we've already specified, identified some of those in terms of potentially young people, or particularly as well, if we look at the experiences elsewhere, some of the BAME communities as well, where sometimes there's been some struggle to get some traction with the messaging and to increase the uptake there. And I know we have, some relatively small communities, but it's really, that makes it more important that we're engaging and, making sure the messaging is appropriate and bringing people with us. We've also talked about some behavioural insights, and we're in the process of commissioning some behavioural insights work. It's generally related to COVID in general, but also we're interested in looking and trying to get underneath whether people do actually have vaccine hesitancy or vaccine queries and what they are, and how we can then best approach working with them to do that. We are aware that there are some anti-vax movements and people trying to promote that in the town. We've seen that with posters going up and various stickers and information all over the place. So we want to try and get a better understanding of really what the population are thinking, or what subsets of the population are thinking and understanding, so we can tailor our messaging as well. So I think that's going to be quite an interesting piece of work. So the other elements we obviously look at are vaccine confidence, and that's, again, we've alluded to. So when we have issues like the AstraZeneca situation, we're able to respond to that quite quickly with information and appropriate information. And then we're looking at breaking it down into particular groups and specific groups. And I've already mentioned particularly ethnic minority groups, but also looking at potentially staff who may be working with people who are more vulnerable, who haven't been vaccinated, or any other workers who may work or be influential with people who may be wanting to be vaccinated. So we'll look at working with those, and I think there's some behavioural insight work going on to consider that. And how we propose to do that is we're looking at pulling together a plan to work with that, but also looking at using existing groups such as our community champions, but also the council's looking at developing a community engagement programme, a community engagement team who will be able to work on all aspects of COVID, but again with some focus on how we link in the vaccination programme to do that. And we're looking to obviously develop a working group around that to plan and implement, so that we are ensuring we have all of our partners engaged. Because actually this is one crucial piece of work where I don't think really any of us can do this on our own. We really do need the support of as many people as we can get to partner with us to do that, but also to feed back information as well. It's kind of a two-way street, so we have a better understanding of what the community are thinking and how we can support them to increase vaccine uptake. And it's not necessarily issues around vaccine hesitancy. We've also got to consider things like the practical aspects. One of the things that comes up time and again is access to sites. And I did have a map here that Karen kindly sent me before, which I shall see if I can try, and I think it was on the end of my presentation. But it does show it shows the sites. I can't get it up now actually on the screen, but it does show the sites we have in Hartlepool, enabling people to get be vaccinated. But also we need to consider how we can support people to do that. And often we know we've got a very low car ownership in Hartlepool, but often it's not just as simple as putting on transport, and it's how we work with people who may have other elements that make it more difficult for them to access vaccinations and vaccination sites. And I think as we come down the age groups, we may find that happening more and more often. So it's again how we work with partners to support people to enable them to access sites as well. So I think the aim of this is to really just have a discussion about how we can work more closely together, any ideas that we can then take away and feed into our action plan, and also the proposals that we have for developing the community engagement work. And on that note, I don't know whether, and I'll put Gemma on the spot here, because she has just sent me over a proposal, whether she has anything to add to that or wants to add anything to that in terms of the proposal.
I mean, I can add to it, Craig. Yeah, definitely a on the spot situation there. But yeah, I mean, you've probably articulated in general terms of some of our thinking. I suppose as we've been engaging with specific community groups throughout our wider work, especially linked to the support hub and also linked to our VCS engagement, we've just gone through a process of awarding money via a community pot, and there's a huge amount of exploration with some of those collaborations that have been awarded funding to be able to understand what we need to do. More notably with the BAME community, we know that there's some quite active leaders in that community who aren't wanting to progress with a vaccination, and therefore their leadership within the communities and how that's translated in terms of others then not wanting to progress with that is quite significant. And again, some targeted work linked to the newly formed CLIP, the Community-Led Inclusion Partnership, and how access to information is also a priority, especially for those with sensory impairments, and ensuring that we're considering how we're providing clear and concise information so that people can access what they need to, even before they access the services. And in addition to that, some work with those that are homeless and again kind of experiencing substance misuse. Obviously, a lot of the information is going to people via, addresses and communications that would necessarily be, for most of us, a stable contact, but we know that there's a population that aren't having that. So there's some really good emerging insight that's starting to kind of come through to us, and we want to expand on that even more, as well as the clinically extremely vulnerable population. Sorry, my daughter makes a guest appearance when I start talking. Apologies. And I think outside of that, we want there to be a more sustainable workforce linked to this work. What we've been doing at the minute is having temporary infrastructure that's been stood up and stood down from redeployed staff. We want to try and support a bit more consistency with being able to kind of demonstrate the impact of what we're trying to achieve. I suppose I don't want to say too much because the proposal I've sent to Craig, I'm sure needs to go through some additional processes before it's agreed that that's what we can do. But I suppose it's just worth saying that we have a huge amount of insight starting to kind of emerge, and what we need to do is embrace that and ensure that we can kind of use it to inform what we do next, specifically around testing, vaccinations, but again acknowledging the level of health and social inequality that's emerging, and how we start to work with the population around easing of lockdown measures, reintegrating people back into the community. We know we have 9% of our population that are CEV, and on that basis reintegrating them around some of the wider social anxieties and ill mental health is going to be a challenge, but we're trying to address all of that. So what I've sent to Craig probably 20 minutes before this meeting, so apologies Craig, is just some thoughts and considerations around that, and hopefully we can start to share some of that with partners and add to it and work up quite a robust plan. I think a lot of it sits in the outbreak control plan. I think what we need to do now is translate the, that's what we're going to do, and it's the how we're going to do it bit. And I suppose as provider services, we can add some capacity to that, as well as some of the proposed infrastructure that we can stand up. And then alongside the VCS and wider colleagues, because the VCS are the ones that are often working in the heart of community, so they're a critical partner in ensuring that we can do this justice. Sorry, that was a load of waffle, but I hope it made some sense.
I think the important thing to mention there, and obviously that Gemma outlined as well, is that whilst we're looking at specifically at vaccinations at the moment, this is all part of the wider sort of input we have across the board. And there's a lot of, as Gemma's mentioned, there's been a lot of learning we've learned from other aspects of the programme we've had over the last year to support the COVID response. And that obviously includes things around the testing and the support for people as well. So I think it's obviously not to be seen in isolation either. But I think that's just sort of the overview of where we're at. And I thought we thought it'd be useful if we could bring it to the meeting to discuss and see where we certainly this working group can engage with that whole plan and move it forward.
Thank you, Craig. Thank you, Gemma. We've got Stephen Thomas.
Thank you, Chair. And I think the plan that Craig and Gemma have just outlined is very comprehensive. And I think that it covers, I would say, most of the basis for for where we need to be heading going forward. And I think one of the things that I would like reiterate from what Gemma has just said is the importance of the community and voluntary sector going forward, and the work that Julie and her colleagues have been doing at Hartley Power. And I think that messages from the local authority, as we've said before, messages from health providers, don't always hit home with everybody out there in the community, and very often messages from the community and voluntary sector, from carers organisations, from mental health organisations will hit home with some people in a way in which the same message from us doesn't. And I think that the work that they're going to be doing going forward in the community and voluntary sector is absolutely vital and very, very important. And I think the other thing that needs to be picked up going forward, it's that mental health issue. I think as we start to come out of lockdown, as people start to return to a degree of more normal living, then I think there's going to be a lot of mental health issues start to surface, which we haven't as yet picked up. And I think that they really have got to be on the radar for the authority, for health providers, and for our community and voluntary sector colleagues going forward. As I think, as we've heard already from the government, from the World Health Organization, the long-term mental health implications from COVID are not going to be over in a year or two. They are going to be with us for many, many years to come. And for some individuals and families out there, they will never probably fully get over what has happened during COVID. So I think it's really important that whilst we're dealing with those issues that Craig, you dealt with in the first part of the meeting, that we do bear in mind some of these things that are going to be starting to come more to the fore as we move into the next phase of this.
Thank you, Stephen. You raised some obviously very good points there. Are there any other questions or comments from anybody else? No. Okay. If you if there is anybody that wants to feed anything in separately to either Craig or Gemma, or any suggestions on how you can engage with that, if you please can reach out. Even if you're not comfortable bringing it now, or it's something you think of at a later date, please do reach out, and I'm sure your input would be greatly appreciated. Craig, again, Hartlepool Outbreak Control Plan.
Yep, surprise, surprise, it's me again. This is just to update the engagement board on the refresh of the Outbreak Control Plan, or what actually is now being called is the Outbreak Management Plan. Some of you may be aware who are involved in the overall response we've had, that around about last June, all local authorities were expected to have a multi-agency outbreak control plan, which outlined the response to outbreaks and how we operated with our partners. We were asked 2 weeks ago to update them to sort of reflect what's happening with the roadmap leading out, and also to have a bit more of a comprehensive plan to reflect current activities. So you'll be aware that obviously coming out of lockdown, we're going to need to have more comprehensive testing. There's a desire to make testing, the lateral flow testing, something that people do more often on a daily basis, or 3 or 4 daily basis, I think, rather than just waiting until symptomatic. I think there's a push to that, and there's changes around how we manage outbreaks and how we use data for surveillance and things like sustained transmission as well. So we've had to update very quickly the plan, and we've done that and forward it off to central government for comment. But again, it's just to let people know that it's been updated, and that we'll probably be circulating it around various people to review it and to see to highlight exactly what it is that we've had to update. I think it is quite positive, other than the time we've had to do to update it, because it does. Things have changed quite significantly from last June. And I think obviously including elements, as I said before, we're not just able to focus on things like vaccination support and that side of things. It is part of the bigger picture. and we need to include all of these elements such as testing, contact tracing, and changes to contact tracing as well together as we move out of that response phase and into the roadmap out of lockdown. So I think it was really just to flag that up with partners, just to make sure that they're aware that that's what we've been doing. Some of you will have been involved in updating it for us as well, which has been much appreciated. And I think we'll be sort of finalising it over the next couple of weeks with those of you who want to comment on it. And I think we have to publish it as well once we've got it completed. So it's just to make people aware of that.
That's great. Thank you very much, Craig. Are there any questions or comments from members? No. Okay, great. Thank you, Craig. I don't have any other business for this meeting, and the date of the next meeting is still to be confirmed, but it would be wrong of me not to take the opportunity to thank you all very much. This is probably going to be the final meeting of this municipal year, so well, this isn't exactly a working group that was around this time last year, and I would hope it certainly isn't around this time next year. But I would like to thank you all for your input over this period. It has been appreciated, and helping us get the message out into those hard to reach communities has been an absolute godsend. So thank you all very, very much. And that's it. So have a good day.
Thank you.
And,
Bye, everybody.
Bye.
Thank you. Bye. Bye.
Bye-bye.